Hey, well, it is Heart Health Month, and I'm here with Dr. Caitlin Giesler. Thanks so much for waking up with us. She is a cardiologist for Ascension Seton. Cardiovascular disease is the #1 killer of women, causing one in 3 deaths each year, and that is according to the CDC, of course. So we wanted to chat this morning about the disease and how it affects women in particular.
Right, so women are at high risk for heart disease over their lifetimes. 1 in 3 women die, as you said, from heart disease, and a lot of women don't know that it's the #1 killer. Importantly, women have certain things that occur specifically in their lives, such as pregnancy and menopause, that can affect their overall heart health. So we want to focus on reducing the numbers of deaths and heart disease in women.
That's pretty scary. What are some of the symptoms that we should look out for, that kind of allude to having heart disease?
Right, so your heart is the engine of your body, and you use your heart mostly when you're active. So a lot of the signs and symptoms come when you're active. When you try and walk, especially up a hill or up a flight of stairs, sometimes you feel chest pressure and discomfort or shortness of breath. Your heart's just not keeping up with your needs, and those are signs of heart disease often.
Oh, wow. So for people, like I have exercise-induced asthma, it's kind of hard to differentiate between oh my God, is there something wrong with my heart, or is it just my asthma flaring up? How can you tell the difference?
Well, that's my job, really. So you talk to your doctor, really. We know that certain risk factors occur that can increase your risk of having heart disease. So if you have high blood pressure, if you have diabetes, if you have high cholesterol, then you're more likely to have heart disease. So if you're having shortness of breath and you have risk factors, you definitely need to think about heart disease as a cause.
Okay, so what can we do to reduce the risk of heart disease?
So the way to reduce risk is to address those risk factors and to follow a healthy lifestyle. So make sure you control your blood pressure, control your cholesterol numbers, control your diabetes, don't smoke, and then healthy living, which is exercising 30 minutes 5 days a week and eating lots of fruits and vegetables.
I was just curious, with the pandemic, I know toward the beginning there were a lot of people who were kind of putting off their checkups, their annual checkups. Are you guys still seeing more women being diagnosed with heart disease just because they have kind of been putting their health to the wayside?
Absolutely. And that's a thing that is common for many women, is that they take care of everybody else in their families and forget to take care of themselves. So that was amplified during the pandemic. They're taking care of their parents and their children, and then didn't follow up with their regular doctor checkups. So their blood pressure is poorly controlled, they don't know their cholesterol, and some of these risk factors have been uncontrolled.
Wow, a very important topic. Thank you so much for joining us. Any other tips for any women out there or families out there watching this morning?
The main thing is know your numbers. If you don't know for sure what your blood pressure is running or what your cholesterol is running, get it checked and ask your doctor.
All right, Caitlin Giesler with Ascension Seton. Thank you so much for waking up with us this morning. We appreciate it.